babies are referred to me because they're having trouble latching, and the mom has already seen a lactation specialist, a pediatrician. Sometimes I've also worked with other special therapists, and they haven't been able to achieve a good latch. And so at this point, they just want the babies to get checked to make sure there's no anatomical restrictions happening within the mouth. And they're referring to the lip, the tongue, and sometimes also other parts of the mouth as well, including the palate anatomy and the upper and lower arch anatomy. A laser frenectomy is going to be necessary when we do indeed find restrictive ties, and that may be the lip tie, that may be a tongue tie, or that may be a combination of both. The classification for a lip tie and tongue tie is somewhat important, though I don't like parents to get hung up on a number. You have the classifications from 1 to 4 for the lip tie and for the tongue tie, and I don't like to just get hung up on that number because we have to look at tongue ties and lip ties as a whole to see how they are affecting with the movement of the tongue and the lip. And a lot of times a classification that seems to be low, the tie can be very short, tight and restrictive. Times a classification that seems to be a 3 or a 4, although they are very restrictive too. Most of the time, there are those exceptions where the tie may be very long and stretchy and not interfering with the movement of the tongue or the lip. The procedure is a laser frenectomy procedure. We will swaddle the baby, we will apply a topical anesthetic under the tongue, and we don't inject any local anesthetic there because there's a lot of other blood vessels that we don't want to accidentally get into. For the upper lip, we do apply both a topical anesthetic and we do apply a local anesthetic as well, and it's one that is safe for babies to use. After this, we do proceed to remove the tissue, and what I'd like parents to know is that it's not just making a cut across the tie, it's actually a thorough removal of the tie. So pain can vary a lot for babies. We can have babies on one side of the spectrum where the parents will attest that there was very little to no pain, and that's wonderful. I actually can't believe that some babies will go through the healing without acting like there was discomfort. And we have babies on the other side of the spectrum where they may have a few days, 2 or 3 days, that may be a little rough, and what that means that the baby may be fussy, he or she may be eating a little bit more and more frequently. You may have to do something to help with the discomfort. And then we have babies in between from either side of the spectrum. So the pain level can vary. I've also noticed that pain level can be related to the baby's temperament. Babies that seem to be very sensitive to things tend to have a harder time than babies that seem to be very chill, very relaxed, and that not much faces them. So I see different things happen. I see sometimes babies will go straight to the breast after the procedure and they're hungry, and that can be very soothing and comforting. And other times the babies are pretty upset that they don't want to latch immediately. At times what I notice too is that they seem like they know or they feel their mouth feels different. So even though they're trying to latch, it may be a little difficult, but it varies again from baby to baby. Like I said, some babies will go straight to the breast, and then some other babies will take a little bit of time to get on the breast again. And something that I advise parents is that if the baby is already taking bottles, is to come prepared with a bottle, so that way if they're not able to get on the breast immediately, sometimes the bottle works a little bit better initially. If the babies are on bottles and the breast and they are struggling a little bit in the beginning to latch to either one, what I also do recommend is to use a little syringe to drip some milk into the baby's mouth, and that typically can get them calm enough that they then will go into the breast or will go to the bottle. But babies typically don't starve themselves, so they will latch eventually. It's just that sometimes immediately it may not happen. So I just want to encourage parents to know that it will happen, but sometimes they're just too upset and they don't want to do it immediately. I like to have parents come in a week after the procedure is done so that I can check the areas to see how they're healing and give them advice on how much longer to do the gentle massages on the baby for, and also just see how they're doing as far as their breastfeeding is going, and check on any things that may be unusual. Typically it's a very quick visit, and for most babies it's just a quick check. It's not as long of an appointment as the first time. If a baby is experiencing pain and the parents want to know what to use to give their baby, or if a parent wants to come prepared to their appointment just in case their baby does have to have surgery when it comes to pain. For parents that like to use homeopathics, there's two that I recommend, and they're going to be these two right here, the Kids Relief and then the Rescue Remedy. And typically used in combination, they can be a very good aid to help a baby feel better. And for those parents who like to use the over-the-counter medications, the main thing that you're able to use for a baby that's under 6 months of age is going to be the infant Tylenol. If you know your baby's weight at the time of the appointment or the last weight they had, we can give you a dosage based on that, so that way you know exactly what to give them. Most of the parents that have resorted to the infant Tylenol report that they usually have only had to give one dose or half a dose, and typically that was enough to help the baby out. And then after that, the baby seemed to be fine just on the homeopathics for those parents that use the homeopathics.